You know that feeling. You're in a crowd, maybe a bustling street, or just scrolling online, notifications pinging, but you feel completely deeply alone.
Mm-hmm. It's a strange feeling, isn't it? Especially now when we're supposed to be more connected than ever.
Exactly. And it turns out it's not just a feeling anymore. We've been digging into this, and what we found is, well, it's genuinely alarming. Loneliness is a global health crisis.
It really is. It's gone far beyond just a personal issue. The latest global research, especially this major report from June 30th, 2025, it paints a stark picture.
Stark is the right word. The headline figure from that report is it's a bombshell, really. Loneliness is implicated in the deaths of 100 people,
Okay.
every single.
100 people an hour. Just let that sink in for a moment.
Like a small town disappearing every day. It's not just background noise, it's a public health emergency.
Yeah, it really reframes the whole thing. We have all these tools to connect, but that fundamental human need for, real connection, it seems to be getting lost somehow.
Like having a pantry full of food, but still feeling hungry.
Precisely.
So that's our mission for this deep dive. We need to cut through the noise, understand the sheer scale of this silent epidemic, figure out why it's happening, and crucially, what we can actually do about it. Find those paths back to genuine connection. Ready to unpack it.
Absolutely. Let's start with the numbers, the cold, hard data we've gathered. Globally, we're looking at roughly 1 in 6 people reporting they experience loneliness.
1 in 6? That's huge. It's about 1.25 billion people.
It is. And honestly, we suspect that figure is probably low. There's still such a stigma, People don't easily admit to feeling lonely.
That makes sense. And there's a really striking divide based on income, isn't there?
Oh, definitely. The rate jumps dramatically in low and middle income countries. It's around 24% there compared to about 11% in high income nations.
Wow, more than double. That really highlights how much social well-being is tied to economic factors.
It does. And who's being hit hardest? Well, you might guess older adults, and they are certainly affected. But surprisingly, the highest rates we found are among adolescents and young adults.
Really, teenagers and people in their 20s.
Yeah, age 13 to 29. Somewhere between 17 and 21% report feeling lonely. Older adults, say over 65, are definitely up there, maybe 1 in 3 feeling socially isolated, but the youth figures were, yeah, quite startling.
That is surprising. And we need to be really clear here. This isn't just about feeling blue. Loneliness itself doesn't directly kill, but it's a massive risk factor, right?
A huge risk factor. We're seeing it increases the risk of premature death by 26 to 29%.
26 to 29%. How does that compare to other health risks?
Well, get this, the impact is comparable to smoking 15 cigarettes a day or being obese.
15 cigarettes a day.
Right.
That really puts it into perspective.
It does. And the specific physical toll is clear too. We've seen compelling research linking chronic loneliness to a 30% higher risk of heart disease
30%.
and a 50% higher risk of stroke. It seems to trigger these harmful stress responses, putting constant strain on the heart and blood vessels.
So how do we even grasp the scale of this? It feels so invisible.
The analogy that really stuck with me to try and make it tangible is imagining a jumbo jet, maybe carrying 300 people, crashing every few hours.
Wow.
That's the kind of hidden daily toll we're talking about with loneliness.
That's a powerful and, frankly, quite chilling image.
Yeah.
Okay, so let's look closer. Who are the unseen faces here? Who's really bearing the brunt of this?
Well, we've touched on young people. It's startling. Think about it, the social pressures, the academic stress, and then their social media.
Ah, yes, the highlight reels. Scrolling through Instagram, seeing everyone else's seemingly perfect life, while yours feels like, well, like the blooper reel.
Exactly. That curated perfection creates this immense pressure and sense of inadequacy, of being left out, even when you're technically connected.
Yeah, and then older adults, of course. We see big triggers there like retirement, losing a spouse or friends, maybe declining health, limiting their ability to get out.
Right. Picture an elderly person, perhaps in a rural village in India, miles from the nearest neighbor. Maybe their children have moved to the city for work. That traditional support system isn't there in the same way, and they're left. Well, very isolated, just wanting someone to share a cup of tea with.
That's a very poignant image. And what about marginalized groups?
They face heightened risks, too. People with disabilities, refugees, migrants, LGBTQ plus individuals, ethnic minorities, they often battle discrimination, displacement, language barriers, or just a lack of a supportive community that truly gets them.
Like shouting into a void almost.
Yeah, feeling unseen, unheard. Imagine being a refugee in a totally new country, trying to navigate everything, feeling utterly disconnected from your roots and maybe not yet connected to your new surroundings.
And underneath all this, we see some common threads, right?
Huh.
Things like poor health, low income, just living alone.
Exactly. Those are key drivers. And interestingly, loneliness isn't just a rural or urban problem. It thrives in both dense cities where neighbors are strangers, and sparse rural areas where distance and lack of infrastructure create physical and emotional barriers. It's like being stuck in a social desert wherever you are.
Okay, so the big question then,
Yeah.
why? If we're theoretically more connected, why this profound disconnection? It's not just about being physically alone, is it?
Not at all. It's about the feeling of disconnection even in a crowd. And there are several layers to peel back here. Socioeconomic factors are huge.
Like poverty, unemployment.
Yes, we found a really strong link. Low income, unemployment, lower education levels, they all correlate with higher loneliness. If you're constantly worried about basic survival, finding the time, energy, or money for socializing, it just falls down the priority list.
That makes sense. You see that very clearly in places like India, where economic stress is just a daily reality for so many.
Absolutely. Then there are health challenges. Chronic illness, disability. It can make it physically hard to engage, or people might feel like a burden or withdraw.
But mental health plays a role too, right? Like depression.
Oh, definitely. It's often a vicious cycle. Loneliness can worsen depression and anxiety can lead to more isolation. You get trapped.
What about big life changes?
Major triggers. Moving house, especially to a new city. Divorce. Bereavement, losing a loved one. These things can shatter your existing social network overnight.
Yeah, starting over socially is incredibly hard. You could move to a massive city like, say, Mumbai, be surrounded by millions, but still feel utterly alone, eating dinner by yourself night after night.
Exactly. And then we have to talk about technology.
The double-edged sword.
Precisely. It connects us globally, which is amazing in many ways. But we've observed it can also isolate us locally. If too much time is spent online, it often replaces face-to-face interaction.
So you end up with hundreds of virtual friends, but maybe no one you can actually call to help you move house.
Kind of like that, yeah. It's quantity over quality sometimes. Like having a vast digital library but never discussing a book with anyone.
And this ties into how our communities are changing too. Urbanization.
Big time. Modern cities, with their high-rise apartments, often lack those old-school, tight-knit neighborhood vibes. We mentioned India. Its urban population jumped from 31% in 2011 to 36% by 2025.
Right.
And with that rapid growth, those traditional community bonds often fray. You might live next door to someone for years and barely know their name.
Neighbors without benefits, as you put it earlier.
Yeah. And cultural shifts are a part of it too. Even in traditionally collectivist societies like India, we're seeing changes. The traditional joint family, which was a huge buffer against loneliness, is becoming less common as young people move for education or jobs, seeking more independence. Nuclear families, even single-person households are on the rise. They reached 10% in urban India back in 2021.
So it's this perfect storm, really. Economic pressures, health issues, life changes, technology's impact, urbanization, cultural shifts, all converging.
Exactly, leading to that paradox.
Right.
More connected than ever, yet feeling lonelier, like being at a huge party where everyone's just glued to their phones, texting someone else.
Okay, let's talk about the consequences. You said it's a literal killer. How does loneliness actually damage us?
Well, the physical health impacts are severe. We mentioned the heart disease and stroke risk 30% and 50% higher, respectively, for lonely middle-aged and older adults. That 2025 Harvard study really highlighted this.
And that's down to the stress hormones like cortisol.
Primarily, yes. That constant low-grade stress strains the whole cardiovascular system, but it goes beyond that. Chronic loneliness messes with metabolism, too.
How so?
It increases the risk of type 2 diabetes by about 20%. Plus, people often turn to unhealthy coping mechanisms, comfort eating, maybe being less active, just scrolling or binge-watching instead of engaging.
Right. And what about the brain?
Huge impact there, too.
Fine.
Social isolation raises the risk of developing dementia by a staggering 50%. A Lancet study in 2024 really drove this home.
50%. Why?
Essentially, our brains need social stimulation to stay healthy. Without regular interaction, cognitive function can decline faster. Think of it like a muscle. If you don't use it, it weakens.
And that comparison, again, the impact rivals smoking 15 cigarettes a day.
It bears repeating because it's so shocking, especially in places like India, where heart disease is the #1 killer, 1.7 million deaths a year. We have to wonder how much hidden loneliness is contributing to that number.
The physical toll is clear. What about mental health?
Equally devastating. Lonely individuals are twice as likely to develop depression. That came from a 2024 American Psychological Association poll. Anxiety often tags along to the isolation breeds worry, fear of rejection.
And the link to suicide risk.
Tragically, yes. We've seen studies, like a global one from 2023, showing a 25% increase in suicidal thoughts linked specifically to loneliness, especially among young people.
25%.
Yeah.
And in India, where suicide rates climbed to 12.4 per 100,000 in 2022,
Yeah.
loneliness must be a significant, if often unspoken, factor.
Almost certainly. And the impact ripples outwards beyond the individual. Loneliness has huge societal and economic costs.
How did that work?
Well, think about the workplace. Lonely employees tend to be less productive, less engaged. Estimates suggest this costs employers billions, like $154 billion a year in the U.S. alone.
Wow. And healthcare systems.
They feel the strain, too. Treating all those loneliness-related physical and mental health conditions costs a fortune. The UK estimated it at about $2.5 billion annually.
Plus potential links to other social issues.
Yeah, we see correlations with higher crime rates, substance abuse. Sometimes people seek escape or connection in unhealthy ways when they feel isolated. It's a domino effect. One person's loneliness can trigger a cascade of costs for society.
No wonder the U.S. Surgeon General called it a defining challenge of our time.
It absolutely is. But, and this is really important, it's not an invincible crisis. There are things we can do. We've actually identified a pretty clear roadmap for change. There's hope here.
Okay, that's what we need to hear. What's the first step?
Honestly, just talking about it.
No.
Openly. Breaking the stigma. Public awareness campaigns are crucial to normalize the conversation, make it okay to say I feel lonely, and to seek help.
Like what the UK did with their loneliness strategy back in 2018.
Exactly. And it had a real impact. They saw a reported 10% drop in loneliness among older adults by 2023, partly just from raising national awareness. India, with its massive media landscape, could do something similar, really leverage that reach.
So awareness first. What about interventions for individuals?
There are effective tools. Cognitive behavioral therapy, or CBT, has shown great results.
That's the therapy focused on changing negative thought patterns.
Right. It helps people reframe those isolating thoughts, build social skills. Studies show it can reduce loneliness by around 20% within 6 months. Support groups are also vital, providing safe spaces where people can connect with others who understand.
And on a community level, what works there?
Creating physical spaces for connection is key. Think social hubs, libraries, community centers, parks, making them welcoming and active. Japan has these salons for seniors, and they reduce loneliness by 15% in pilot areas. Imagine if India's, say, 780 medical colleges also functioned as community health hubs, offering social programs.
That's an interesting idea. Combining health and social connection.
And volunteering. It's incredibly powerful. It gives people purpose, connects them to others. We've seen it reduce loneliness by about 22%. India's national service scheme could potentially expand to specifically target loneliness.
Okay, and you mentioned something lighter earlier, pets.
Haha. Yes, the furry antidote. Seriously, though, pets, especially dogs, make a difference. They reduce loneliness by around 30%.
30%? How?
It's partly the companionship, of course, but dogs also get you out of the house talking to other dog owners in the park. They're social catalysts. Cats, fish, birds, they help too, reducing stress.
And pet ownership is rising in India, isn't it?
It is. Around 10 million dogs, 2 million cats back in 2023. Promoting pet adoption, maybe especially for seniors or people living alone, could be a simple but effective strategy. Imagine a lonely retiree's face lighting up.
Yeah, you can picture that. Okay, thinking bigger picture now, societal changes.
Well, we have to address the root causes. Tackling poverty, discrimination, those underlying inequalities that fuel isolation. And urban planning matters.
How we design our cities.
Exactly. Building cities with more green spaces, communal areas, places where people naturally bump into each other. Singapore's done some interesting work with their Kampong Spirit initiatives and housing estates.
And did it work?
They saw a 12% reduction in loneliness in those areas. It shows thoughtful design can foster connection.
And technology. How do we get the balance right?
That's the million-dollar question, isn't it? The key seems to be using it to enhance real-world connection, not replace it. We know India has, 900 million internet users? That's immense potential for connecting families, yes, but also for things like online support groups focused on specific interests or health conditions. Those have actually reduced loneliness by about 18% in some trials, using tech to build towards face-to-face or at least meaningful virtual community, like local WhatsApp groups or Meetup.
So it's about intentional use.
Exactly, not just passive scrolling. And finally, we need leadership. Policy matters.
Are governments actually doing this?
Some are. At least 8 WHO member states, like Australia and Japan, now have specific social connection policies. The UK's Minister for Loneliness, created in 2018, was groundbreaking.
And did that role make a difference?
It seems so. They reported a 5% reduction in loneliness nationwide, attributed partly to the initiatives that followed. India, with its focus on strengthening healthcare, could definitely create a similar task force or dedicated role.
It seems like a really complex web, but there are definite threads we can pull on.
There absolutely are. It requires action on all levels, individual, community, and policy.
So just to sort of wrap this up,
Yeah.
the core message we've uncovered is pretty stark. Loneliness is this silent killer impacting health, society, the economy.
And it's a crucial, but it's not invincible. We've seen there's this powerful, multi-pronged approach that actually works.
Raising awareness, building community hubs, using tech wisely, tackling inequality, getting policymakers involved.
It's a collective effort, and that includes every single one of us. Individual actions really do matter here.
So maybe the takeaway for everyone listening is the next time you pass a neighbor, maybe someone you see every day but don't really know, just say hello, ask how they're doing.
Exactly. It sounds small, maybe insignificant, but you never know. We've found that sometimes that tiny gesture, that moment of human connection, it might just be the thing that saves a life.